Hello guys, welcome to the Base Talk Show. Today I have something interesting to invite everyone to notice. What I'm talking about kidney transplants. Do you know what a kidney transplant is? Okay, some people may not know this. I will explain to you. A kidney transplant is a surgery done to replace a deceased kidney with a kidney healthy from a donor. The kidney may come from deceased organ donor or a living donor, family members, or other who a good match may be able to donate one of their kidney. Its type of transplant is called a living transplant. Do you guys understand this? It would be impossible for me to talk about it alone. So, I would like to invite guests today. Please put your hand together for our special guest. Yay!
If you are appropriate, 18 years or older healthy, you may qualify to be a living kidney donor and save life. 1. You must have no evidence of kidney disease. 2. You must have no evidence of major medical. 3. You must have no evidence of diabetes. 4. You must have normal blood pressure for consideration. 5. You maintain your body weight in the normal range. After donation, our transplant coordinations will follow up with our donor with interval period, lab tests, and will make recommendations as needed to keep them in health. And recipient kidney. 1. You must have chronic irreversible kidney disease that has not responded to other medical or surgical treatment. 2. You are either on dialysis or may require dialysis in the near future. 3. You must qualify for and be able to tolerate major surgery. 4. You and your family member must be able to understand the risk and benefit of transplantation, including the long-term need for close medical follow-up and lifelong need for anti-rejection therapy. And 5. You and your family must be able to accept the responsibility, including financial, that are part of the long-term care you will need after transplantation. Thank you, everyone.
Kidney failure or renal failure is a condition in which the kidney lost the ability to filter waste from the blood, until unable to expel waste from body, thus urine causing waste residue in the body. It also shalling the water level, mineral salts, and various minerals in the body to be imbalanced. There are two types of kidney failure. Type 1, acute kidney injury, also known as acute renal failure, is a sudden episode of kidney failure or kidney damage that happen within a few hours or a few days. Acute kidney injury causes a build-up of a waste product in your blood and make it hard for your kidney to keep the right balance of fluid in your body. Type 2, chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Your kidney filter waste and excess fluid from your blood, which are then removed in your urine. As well, chronic kidney disease can cause dangerous level of fluid, electrolyte, and waste to build up in your body. The main reason includes diabetes, hypertension, obesity, nephritis, renal crystal disease, and other conditions. Chronic renal failure is divided into 5 stages. Especially the 5th stage is the end stage of chronic kidney failure. You have severe damage to your kidney. Your kidney are getting very close to failure or have already failed because your kidney have stopped working to filter waste out of the blood. Waste product build up in your body, which can make you very sick and cause other health problem. When your kidney fail, treatment option to survive include dialysis or a kidney transplant. Treatment for chronic kidney disease focus on slow the progression of kidney damage, usually by controlling the cause. But even controlling the cause might keep kidney damage from progressing. Chronic kidney disease can progress to end-stage kidney failure, with it dialysis or a kidney transplant. 4 stage to 5 stage renal failure are state of a significant decline in renal function, which require multiple treatment in order to maintain the symptom at a stable level. Waiting for kidney transplant is the best treatment for chronic kidney failure.
A property of the living donor is first, he must be between 20 and 60 years old. Second, he mustn't have an underlying like uncontrolled hypertension, diabetes mellitus, chronic kidney disease, obesity, and he mustn't infect an hepatitis virus B or C or human immunovirus, and he must to be a blood relative or legal spouse. Practice after undergoing a kidney transplant. First, he must avoid to lifting and anything heavy than 10 kilograms. Second, be careful not to get a wound wet. Third, if you are vaccinated, you must always inform your doctor, because some vaccine can activate a self-immune for destroy a transplant kidney. 4. Avoid prolonged exposure to the sunlight, because the patient with transplant kidney will get immunosuppressor drug. It makes their risk for skin cancer more than the normal people. 5. Must always follow the doctor appointment.
Treatment guidelines for kidney transplant patients divide the risk as follows. Low risk group who receive kidney donation first from living donors. Medium risk and high risk group are people who receive a kidney donor before and receive the first kidney from brain dead donor. The next things I'm going to talk about induction therapy. You might want to know induction therapy is this is the care before and during kidney transplantation, such as use of immunosuppressants, diagnostic, and drugs to prevent infection. It depends on decision of the doctor conducting treatment. The next step is treatment of acute rejection in kidney transplant recipients. The symptoms that should be taken into account are as follows. Creatinine continue to rise for no alterations, including kidney function not at the expected with a level within 1 to 2 months. The next step should be taken kidney biopsy for examination before starting treatment. After kidney transplantation, drugs should be taken regularly as well as should watch out for symptoms that the implant is not working properly. Thank you.
Negative effect if a kidney transplant is not performed for the patient. Hemodialysis and renal replacement treatment are required for patients on peritoneal dialysis. For life, anesthesia-related complications are one type of immediate postoperative complication. Severe bleeding following surgery, cardiovascular system modification, such as decreases blood pressure, issues with the digestive system, such as bloating and constipation. kidney rejection occurs when the body rejects the replacement kidney. This risk can be reduced if the patient is taking enough immunosuppressant. Reduced immunological response. This makes it possible to contract disease quickly, such as opportunistic illness like pneumonia, fungi, parasites, the Epstein-Barr virus, etc. Psychological. After a kidney transplant, the quality of life for patients with end-stage illness considerable improve, but because they must strictly take immunosuppressants, that some patients may experience anxiety because if you don't practice taking medication, you run the risk of aggravating already existing renal damage that may result from them.
Kidney transplant recommendation during COVID-19 are divided into three groups. Is living donors are required to self-isolate for 7 days, and ANT test for SARS-CoV-2 for both nose and throat for no more than 72 hours. If they have been infected COVID-19, it's more than 28 days from the date of the testing and had a negative result, a kidney transplant can be done. And for donee, SARS-CoV-2 must be tested by ANT method for both nose and throat for no more than 22 hours, as in the first two groups, but if they have been infected with COVID-19, must last more than 6 weeks and have a negative result, therefore can escape kidney donation.